Up next, we have none other than Kumar Doctor Sir to talk about phaco in hard cataracts, and something we really look forward to hearing.
I'd like to thank Dr. Maipal and thanks Shreyas. I'm just going to talk about how I handle it, some basic things, and how I can show the technology. So this was a hypermature cataract and a very hard cataract. So having done the rexes successfully, please note the parameters on the side. So note the vacuum, the aspiration, and the power. So when we are just grooving, you can see that the vacuum really doesn't rise so much. So it just goes till about 60, 65, 100, and then comes back. But notice the flow rate is continuously around 38. So now I take the chopper in, okay? So the size of the chopper, I'm using a sharp tip chopper made by Epsilon, no financial interest. But I don't go beyond the rexis to chop. So I go a little bit beneath, but not all the way till the equator. The sharp tip is never to worry about because there are three designs, a 1.5 millimeter, a 1 millimeter, 1.25, and 1.75. So if you have a fear that you will rupture the posterior capsule with the chopper, it never ever happens. You may sometimes nick the anterior capsule, but you'll never puncture the posterior capsule. So just notice that when I'm burying the tip inside, the vacuum will rise to, I've kept a vacuum at 500. So you can see now the vacuum is to 300, and now the vacuum is held and holding the nucleus and then chopping and then bringing. So first important rule in a hard cataract is to make multiple pies. Don't make one piece and then bring it to the center because the back from that area will collapse. So the best thing is to make at least 8-9 pieces. Don't have a very small rexis. If you have a small rexis and a large nucleus, you'll have to make more pieces to bring them out. So it should be just adequate. A 5.5 or 5.75 should be good enough. I have some setting on my system called case. I'm using a Signature Pro now. I'm using the Veritas. What means is that when the vacuum falls from 500, it falls back to 300, and when the vacuum drops, it further drops down to 125. So there's never a chamber collapse, and that's the biggest safety, and the best viscoelastic has to be used. So I'll tell you more in the other cases. So throughout, I'm using my power setting on the linear at 80%, at 80 power, and it's never more than 10%. So if you notice on the side, it's very, very little use of power. It's mainly the vacuum which is holding the nucleus, and this is how one can go ahead. This is another case. Now this we had demonstrated many years back, and it is called mechanical delineation in situ. You can't hydro delineate this, so you mechanically delineate. I always like to stain hard cataracts. The reason being that you can see the edge of the capsule. If you have a complication, you can do an optic capture. Don't make a large rexis. If you have a large rexis, again you can't do an optic capture. So always a 5.5 millimeter rexis is good enough as far as a hard cataract goes. So staining, I personally feel, should be done in every hard cataract. Make sure that your rexis is around 5.5, as I said, followed by a hydrodissection, and then coming to the main part of phacoemulsification. So again, this is a dense nucleus. So notice the vacuum. I've set the vacuum at 500. Okay, only at this stage, when I'm burying the tip entirely inside to hold the nucleus. So at this stage, there is no second hand going in. So the chamber is very well maintained. The full anterior chamber is filled with viscoelastic, and I prefer to use viscoat. I have no financial interest. Believe me, friends, whether you have Helon GB, viscoat does the best protection and gives you enough space in a very hard cataract. Now the chopper going in. Once the chopper goes in, bury the tip inside. So you can notice that I'm slowly burying the tip inside, and at this stage the vacuum is increasing. So notice the vacuum, the aspiration is completely zero. The chopper goes and points at the level of the rexis towards the nucleus and brings it towards your main tip. Once this is done, there is a separation, and this goes all around. So once this is done, then rotate the nucleus. Don't bring that piece out, and make multiple small pies. Again, bury the tip inside, hold the nucleus. So if one feels that you can need high vacuum to hold the nucleus, believe me, friends, you can do exactly the same even at a vacuum of 200. But here we have the facility called case, so there is no chamber collapse because the vacuum drops, as I mentioned, after the occlusion breaks, it drops back from 500 to 300 to 125, and this does very well. The most difficult part in a hard cataract is a central separation of the fibrils, which are the last part of it. So yes, you will notice that here. Once I've made multiple small pieces, I go ahead and bring the small pieces out one by one, one by one. And then the last plate that actually comes up, and that is followed by irrigation, aspiration, and a lens implantation in the back. So again, you can see that the whole nucleus comes out quite easily, followed by IEA and followed by lens implantation. This is the last case I'm showing. Again, a very hard cataract, underwent femto. So you can see a nice round rhexis, and you can see some grooving that is there, which was done initially with the femto itself. Now I have the Z8. Before that, I had the catalyst. Catalyst can make cubes. The Z8 can also make cubes. But it is known that in the Z8, you can increase the energy depending on the density of the nucleus. That will reduce your EPT a bit than the normal cases that is necessary. So this is a very, very dense cataract, a very hard cataract, and you can see that the grooving is going around. And preferably, friends, don't forget, when you know that you're going to have a hard cataract tomorrow in your OT list, try to get a new phaco tip. Lots of us tend to use the same phaco tip again and again by autoclaving it. Best is to keep a brand new phaco tip, and that itself will really help you a lot. So here you can see the vacuum goes up again to 300 because of total occlusion. Once that is done, try to get the same plane of separation where the femto energy was applied, and that will make your life a little more easy and a little more comfortable. Again, the flow rate is maximum 38. So you'll notice when there is no occlusion at all, the flow rate flows completely to 38, and when there's total occlusion, the flow rate drops to complete 0. So this is very good fluidics. The chamber never collapses. This is all topical anesthesia. Again, a very dense cataract. Underwent flax. Once that is done, you can go all around. So as I mentioned, the central part is the most difficult to separate. Here you can notice that once I hold the nucleus, you can remove the epinucleus with the help of the chopper. Here I'm doing a separation. Now again holding the nucleus, and then again doing a separation. So you can see I got the separation. Once you got the separation, you can go ahead and remove the main part of the nucleus or the endonucleus. Sometimes I mechanically separate the epinucleus with the help of the chopper itself and deposit the epinucleus back into the bag. The big advantage there is it protects the equator of the bag, keeps it away from your phaco probe, and prevents a collapse of the bag occurring in the same spot. So here again I'm going all around, holding on to the nucleus and then removing one piece that is necessary. So here we can go all around. So as I mentioned, the central part becomes the most difficult. Don't worry, have patience, go all around, make multiple small pieces, get them out. Once you are there, always apply the phaco energy when the phaco tip is right in the center. Don't ever apply it beyond. And again, once it is in the center, increase the vacuum after you held on to the nucleus and then apply the phaco energy. So there is no waste of phaco energy at all. And here you'll notice that my average use of phaco energy is only 13%. So that's very, very low. Once the plate comes up, then you can remove one piece of the nucleus and get it out. So you'll notice here, once the whole nucleus is removed, there is absolutely no cortical matter at all. So at this stage, you become careful. And last trick to take home would be that when you are on the last piece, I like to remove my chopper hand. And that itself changes the fluidics and your dynamics in the anterior chamber. So you notice that I removed my chopper, and now I'm going ahead and applying my phaco energy slowly and gently. And when the last part of the phaco tip, the nucleus is there, I like to change the direction of the phaco tip. I'll make it horizontal, I'll make it parallel to the CCC, and not pointing up and not pointing down. Again, that itself, if you have a sudden collapse, you're again away from the posterior capsule, and that itself will help you a lot. So as mentioned, this was a very hard nucleus. There is absolutely no cortical matter at all. And once this is done, there is no other hand piece inside, no other hand inside, and that's the reason why this works quite well. So in conclusion, proper incisions. I like to use dye for CCC, a proper viscoelastic to protect your cornea. Chopper has to be a sharp tip chopper, and then remove it at the end of the procedure before the last piece is out. Use a new phaco tip when it's a very, very hard cataract. And when you remove the last piece that is remaining there, remove the chopper, direct the phaco tip parallel to the CCC, away from the endothelium and away from the posterior capsule. This will prevent all the complications. Thank you.
Very good tips, Kumar, and very excellent videos. And these hard cataracts are always a big challenge, and endothelium needs to be protected. The bag, the size. What's the ideal rexus size that you like if you're dealing with a very hard brown?
5.5.
5.5. And would you prefer a femtorexis in these patients? And for some reason,
Always.
Some people have doubts that the femtorexis won't be strong enough for the lateral separation forces of cracking a hard nucleus. Have you faced a challenge with that?
No, in fact, I don't agree to that, because I made a video which won at the ACRS, which actually demystifies between manual and femto CCC. So if your femto CCC is free floating, it is as strong as your manual CCC.
And
That's
you
my
said that
thought.
you have different sizes of choppers, and how do you decide which one to use?
So the big advantage, we have optical biometry. So when you have these hard cataracts, you know the thickness of your lens pre-op. So the choppers that I have is from 1.25 millimeter, 1.5, and 1.75, and it's a sharp tip with an inner cutting edge. So and they're all made of titanium, so they last for many years. So even if you use a 1.75 and your nucleus thickness is 3.5, these lenses are sometimes 4.25, 4.5. You are still quite safe.